Hormone replacement therapy does not have to be complicated, it doesn't have to be expensive or scary. For most women in perimenopause and menopause, hormone replacement therapy has more benefits than it does have risks. And we know about the basic stuff. It can help with hot flashes and night sweats, but it also can help with sleep, with mood, brain fog, energy, joint pain, low libido, some people hair thinning. And some of those things aren't just annoyances, they're signaling from your body that something needs to be addressed. And so along with hormone replacement therapy, managing those day-to-day symptoms and increasing your quality of life, we also have some data as far as prevention with hormone replacement therapy when it started at the right time, as far as your brain health, your bone health, and your heart health. Research has shown that estrogen is neuroprotective. Women who start hormone replacement therapy at the right time have a meaningful reduced risk of cognitive decline and dementia. As far as your heart goes, estrogen helps support healthy lipid metabolism and vascular function. So hormone replacement therapy started in that perimenopausal window has shown to meaningfully reduce your cardiovascular risk. And as I've mentioned in another video, as far as your bones go, the peak bone loss occurs 2 years before your final menstrual period and then the 2 years thereafter. Bringing in estrogen can help mitigate that loss and reduce your risk of osteoporosis and help you maintain that bone. And it doesn't have to be expensive. There are multiple FDA-approved options that you can find through your regular pharmacy that's covered by your insurance. You should only have to use compounding if you need a specific dose that is not available commercially or if you can't tolerate a certain formulation. So most of my patients are on stuff from regular pharmacy and their costs are not too high. So if you're spending a lot of money, you need to ask your provider why. And you also want to make sure you have a provider who can listen to you and understand the ins and outs of each hormone, because labs aren't always it. They're not all the whole picture. You need to know how to work these things. So I hope that was helpful. And if you're on the fence about HRT, if you have any questions, just let me know.